Hello, my name is Luis Ventura and I will talk about euthanasia and physician-assisted suicide and the psychological effects on patients and physicians. I'm going to start with a question. Are there psychological factors that can affect the decision of a terminal illness patient to opt for euthanasia and physician-assisted suicide? According to Carter et al. In the year 2006, the percentage of cancer patients who have not thought about euthanasia is only 2%, versus 79% of the patients who have thought about it. An interesting fact is that only 5% of the 79% have opted for euthanasia, according to Carter et al. In the year 2006. Some people with strong religious beliefs showed less support for euthanasia and physician-assisted suicide, according to Carter et al. In the year 2006. Carter et al. Also stated that people use religion as a support and they rely on a God that will guide them through their illness. Approximately 10% of terminal illness patients show signs of depression, according to Smith in the year 2015, and 14% will show anxiety, according to Carter et al. However, depression and anxiety showed no greater changes on a patient's decision to support euthanasia or physician-assisted suicide, according to Carter et al. In the year 2006. However, the presence of these two disorders can have negative effect and impact on the patient, and there can be two risk factors. According to Davidson et al. In the year 2011, there are two risk factors. The first one is total belongingness. The person does not feel welcome or part of a group, and the person feels disconnected from other people. The second one is named burdensomeness. The person feels that he's a source of stress to other people, and he feels that he's not contributing to the world. These two risk factors are the cause of a patient to think that he would be better off dead. We have talked a lot about patients, but what about the physicians? Physicians are the ones that approve euthanasia and physician-assisted suicide. According to Stevens in the year 2006, the common values of medicines are to heal and promote human wholeness. So what happened to physicians who have conducted euthanasia or physician-assisted suicide? There are major psychological and emotional effects on physicians who have conducted physician-assisted suicide and euthanasia, according to Stevens in the year 2006. In the United States, 53% of the physicians involved in euthanasia and physician-assisted suicide have felt comfort helping their patients, according to Stevens in 2006. Stevens in 2006 also stated that 24% of the physicians regretted that decision and 16% felt such an emotional burden that their medical practices were affected. Making a decision over someone else's life might bring physicians emotional distress, guilt, or remorse. In the end, the decision was approved by them and the practice was approved by them. According to Stevens in the year 2006, Dr. Emanuel stated that, and I quote him, "To kill someone is something far-reaching and that is something that nags at your conscience. I wonder, what would it be like not to have these cases in my practice? Perhaps I would be a much more cheerful person." He says that he would be a much more cheerful person if he hadn't conducted those practices. So this suggests that there are mood disorders linked to conducting euthanasia and physician-assisted suicide. Sometimes the distress and remorse is so strong that it will force a physician to abandon their careers, according to Stevens in the year 2006. Even though the medical principles are to promote human well-being and heal people, sometimes the correct thing to do for physicians is to end the suffering of a patient and conduct euthanasia and physician-assisted suicide. Some people think that this is not an ethical thing to do and it violates the medical principles, but in my opinion, Physicians are just doing their jobs by putting an end to a person who is not willing to fight anymore because of his or her suffering. I believe that if it is the patient's will, then the best thing to do for a physician is to conduct euthanasia and physician-assisted suicide. However, people always focus on the side of the patient and left aside the physician. The physician goes through a lot of anxiety when conducting euthanasia and physician-assisted suicide. I believe that physicians should be advised to search for psychological help so that their career does not get affected. Sometimes the physicians are so affected that they have to leave their careers because of the burden they feel of conducting euthanasia and physician-assisted suicide. I do think that even though physicians go through a lot of anxiety, euthanasia and physician-assisted suicide is the correct thing to do. And I think that that's the ethical thing to do, because medics are fulfilling their duties as health providers. Thank you.